Okay, thyroid supplements or replacements. All right, the action is to increase metabolic rate. That's your thyroid hormone replacements, like your Synthroid. Increases metabolic rate, increases tissue oxygen consumption, body temperature, heart and respiratory rate, cardiac output, carbohydrate, lipid, protein metabolism. It influences the development of the skeletal muscle system. All right, so uses and replacement therapy, right, for several conditions such as hypothyroidism, myxedema, creationism, or non-toxic goiter caused by deficiency, of thyroid hormones, atrophy, congenital defects, the effects of surgery, antithyroid products, or even radiation. Some of your adverse reactions: hyperglycemia, tachycardia, glycosuria, hypertension, dysrhythmias, hand tremors. You got insomnia, nervousness, menstrual irregularities, increased prothrombin time, increased serum cholesterol levels. Okay, and overdose produces signs of hyperthyroidism. All right, so let's highlight that. Be familiar with all of this, guys. There we go. Okay, so drug interactions. It says may increase the patient's need for anti-diabetic agents, anticoagulants, may be exaggerated by thyroid replacement therapy. Okay, because of increased hypothrombopinia or anemia. I'm sorry. Corticosteroid needs are increased for these patients. Tricyclic antidepressants are increased by thyroid hormones as well. Okay, I want you to highlight. You can see I have the thyroid hormone replacements for lifespan considerations of older adults. Make sure you highlight that and go over that, guys. All right. So nursing implications in patient teaching. Okay. Once again, learn as much as you can about the patient. All right. Does the patient have diabetes, cardiovascular disease, adrenal cortical insufficiency? Are they pregnant? Are young women without thyroid pathology or individuals who need to lose weight often seek thyroid replacement therapy? Look at the assessment. Find skin changes associated with myxedema. Do they have a large tongue, puffy face, doughy skin? Okay. Highlight that there. The thyroid gland may be normal in size, enlarged, or not palpable, depending on the patient. They may have neurologic signs, such as slow thinking, muscle weakness, slowed relaxation. Okay, carpal tunnel cardiac signs include bradycardia, decreased blood pressure. All right. It says patients older than 50 years are often very sensitive to thyroid hormone, so it's important for them to begin on a small dose. All right. It says a cut in dosage followed by a slower increase in the dose may be necessary when side effects occur. So make sure you're monitoring and assessing your patient and teach family members or the patient to be aware of their signs and symptoms. All right. And remember, responses therapy is not immediate. Most patients begin to feel better within 2 weeks. And therapeutic results are often within 3 months. Remember, these medications should be given on an empty stomach before anything else is taken, not to be given with any other medications or food. All right, so take the medications as as ordered. It says the medication should be taken at the same time every day, preferably before breakfast. All right. Remember, they might start to see some improvement for 2 weeks, but it can take up to 3 months for therapeutic results. All right. If the patient is also being treated for diabetes, check their sugar regularly. If they're receiving anticoagulant therapy, bleeding or excessive bruising should be reported right away to the healthcare provider. All right, the patient should check with the healthcare provider before taking any other medications that can cause a reaction with the med. All right, and if they start to have any issues or signs and symptoms of hyperthyroidism or hypo, call the healthcare provider immediately. All right, anti-thyroid products. All right, so these are medications to stop the production of thyroid hormones. All right, and it's usually used to treat hyperthyroidism, Graves' disease, to improve hyperthyroidism in preparation for surgery or radioactive iodine. Okay, it says these agents do not inactivate or inhibit thyroid hormone already stored in the circulating blood. It just stops the production of new thyroid hormone. Adverse reactions. Okay, drowsiness, headaches, neuritis, paresthesia, right? Vertigo, epigastric distress, jaundice, vomiting, constipation, prolonged therapy, WBCs can be low, causing agranulocytosis. It says propylethyracil now carries a safety alert for serious liver damage, including liver failure and death in some patients. So drug interactions, the effects of anticoagulants are increased or potentiated. Nursing implications, same thing. Thorough history, guys. What does the patient, do they have any other drug interactions? Get as much history as you can. Do they have history of chronic heart failure? Are there any issues of hyperthyroidism? Do they have a thyroid enlarged? Tachycardia, increased blood pressure. Look for these signs and make sure you document them. Any laboratory findings that may show elevation T3, T4, or decrease in TSH. Okay. Know your normal lab levels here. Okay, we'll highlight that. You guys read over that. All right. It says antithyroid drugs usually remove symptoms of hyperthyroidism if taken correctly for 1 to 2 years. And clinical response usually takes 1 to 2 weeks because the drugs do not affect the release of thyroid hormones. It says response depends on stopping the production of thyroid hormone in the thyroid gland. All right, so here it says that once the patient has been euthyroid for 12 to 6 months, a decision may be made to reduce the dosage and see whether the hyperthyroidism is under control. Okay. Patient family teachings, take it directly as prescribed. It says because clinical response usually takes 1 to 2 weeks to achieve, dosage should not be increased until the results at the present dosage level can be evaluated. If there's any side effects, look at the side effects. Make the patient know of the side effects, headaches, bruising, skin rash, and so on, and then make sure the patient gets plenty of bed rest. Adequate diet and avoidance of occupational and domestic stress are also useful modalities for these patients. And then complementary and alternative therapies. Oops, I went too far. Okay, you can see here some of these medications are used to help care for some of these. Highlight these, be familiar with it, guys. You might see 1 or 2 on your test. All right, we'll get chapter 20 out to y'all here shortly. Enjoy studying.